dentists not only need to hear the message, but this book is really for folks like us that are thinking about changing our smile and don't even know the first question to ask.
We've written 8 textbooks for dentists, and they're like cookbooks of how to do certain techniques. But for the profession, that's one thing. This is for consumers. And the reason is because too many people make too many mistakes by not knowing what they should have or what choices that they may have.
You even start off in here with a question: what does your smile reveal?
Yes.
As a dentist, how do we answer that question?
Well, it's all psychological and physiological, because what it reveals is your self-image. And if you don't like your smile, you tend to look down, you cover it. You know that there are dark teeth. Psychologically, and subconsciously, it can be a real problem to a lot of people. And if you love your smile, you can be fat or thin or short or tall, and you can still look great. People love a great smile. So it's an asset that you have to have.
Well, that's great advice. There's a reason why this has gone into the 4th edition. And, you know, a lot of it is what you should know before going in, the questions to ask, and then a lot of it is going through the procedures of what's going to happen to you if you take this route, correct? This procedure, step by step, of how the teeth is actually moving.
And how to keep the smile. I've seen so many patients over 50 years that have gotten their smile done at one time, and they don't know how to keep it up. They've fractured teeth. They've had decay. No one has really told them what they have to do to maintain it.
We'll reveal some of that right now, because I am listening.
Okay.
To keep our smiles.
Yes. Well, first, you need to know what you've got. If you have laminates, and those laminates extend down a little bit, you've got to be careful the way you chew. You can't go biting a carrot the way you used to, because that puts torque on that porcelain. That bends, and teeth have a microscopic bending a little bit. And if that's so, the bond that holds that laminate can pop off, and a piece can fracture. So you have to chew to the back teeth. I advise patients to cut up an apple, a hard apple. You eat the hard apple, it's great, but cut it up and eat it back here.
So chewing in the back, it would be the first of many, I'm sure you have.
Yes. Second, fluoride. You've got to have a good fluoride paste, and you have to have a higher concentration than many times you can buy over the market. So get your dentist to tell you which one is best for you. And third would have to be the type of brush. You don't want a hard brush. That's why we like something like a Rotodent, or very soft fiber brush. And if you can just clean off the plaque, that's all you have to do.
Great advice, Doctor. And we look forward to having you back. And thanks for getting us connected.
My pleasure.